Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the hilum and root of the lung. We have questions and we have answers. So, what is the hilum of the lung? The hilum of the lung is a space on the medial surface of the lung, and through this space multiple structures get in and get out. So this space is called hilum. Through the hilum, multiple structure gets in and get out. Those structures forms the root. So structures are the root, and the space for the structure is the hilum. This is the hilum. This is present on the medial surface of the lung. So we have the left lung with the right lung. This is the hilum of the right lung. This is the hilum of the left lung. And that hilum contains the structure. Those structures are called root of the lung. Okay. So what is the root of the lung? Root of the lung are the structure. They forms a pedicle, a bundle of structure like that of the bronchus, the pulmonary artery, the pulmonary veins. We'll also get the bronchial artery. We'll get the bronchopulmonary or hilar lymph nodes. We'll get the sympathetic, parasympathetic, and visceral efferent nerve fibers. So they all forms the root of the lung. What lies between the lungs? Between the lungs, we have the mediastinum. What is mediastinum? Mediastinum is the partition. It is composed of multiple structures which are located in between the two lungs. Okay, so lungs are not a part of the mediastinum of the thorax. The structure in between the lungs forms the mediastinum. Suppose heart, the blood vessels, the esophagus. Okay, these are the part of the mediastinum. Lungs are not a part of mediastinum. In between the two lungs, we have the mediastinum. What structure forms the root of the lung? Again, we have the bronchus, the pulmonary artery, pulmonary veins. We should have bronchial artery. We should have sympathetic, parasympathetic nerve, visceral efferent nerves. We should have bronchopulmonary lymph node or hilar lymph node, and certainly we should have loose irregular tissue that keep all the structure together. Okay, so we got the structures forming the root of the lung. How the lungs are connected to the mediastinum? The lungs are connected to the mediastinum by this pedicle of structures. These are the roots. So the lungs are connected to the mediastinum by the roots. Okay. How many bronchial arteries? On the right side, it is usually one bronchial artery that comes out of the right posterior third intercostal artery. Okay. And the left side, usually two left bronchial artery. Those are coming from the upper part of the descending thoracic aorta. Okay, there is some always variation. Okay, so what is the vertebral level of the root of the lung? Vertebral level of the root of the lung is T5, thoracic vertebra 5, thoracic vertebra 6, and thoracic vertebra 7. This level will change based on the status of respiratory movement. Okay, suppose during inspiration and during expiration, there will be some difference. Okay, so we got that the vertebral level of the root of the lung. So again, root means the bundle of structure, and the space for the root is the hilum. This is the right lung, this is the left lung. Left lung has cardiac notch and it has large cardiac impression and one fissure Okay, right lung should have two fissure and it has no cardiac notch and no lingula. Here we have the cardiac notch and lingula. Okay, we know the differences between the left lung and the right lung. Okay, now again we should have some idea about hilum and root of the lung. This is a tree. Suppose this is a tree. Tree has the root. This is the root. So these are the roots of the lung. Okay, root. And the space for the root, suppose you have uprooted the tree has been taken out. What is on the soil, this depressed area, this is the hilum. Hilum is the space. Hilum is not the structure. Hilum accommodate the root like this structure, like that of the pulmonary artery and pulmonary vein, the bronchus, and other structure like the sympathetic plexus of nerve, sympathetic and parasympathetic nerve, and the pulmonary plexus, and the visceral efferent nerve fibers, plus lymph node. These are the part of the root, and root is present inside the hilum. Hilum is the space for the root. Okay, hilum is present on the medial aspect of the left lung and right lung. So we look at that. This is the, what is this? Mediastinum, where it is located between the lung. This is one lung. Okay, the left lung here, right lung here. In between the lung, we have the group of structure. We call them mediastinum. Lungs are not part of the mediastinum, but we have heart here, pericardium here. We have the esophagus, descending thoracic aorta. These are all the part of the mediastinum. We have the superior mediastinum, inferior mediastinum. Inferior mediastinum has three divisions: anterior division, middle division, posterior division. We discussed in our mediastinum video. Okay. So here again we have the mediastinal pleura. Here is the mediastinal pleura, and on the lung we should have the pulmonary pleura. So around the hilum, the mediastinal pleura is continuous with that of the pulmonary or visceral pleura. Okay, so we are looking at the hilum and root of the lung. What are the relations of the structures to the root of both lung from before backward? From before backward. So we should have the superior pulmonary vein, then we should have artery, and we should have the bronchus. Bronchus is usually posterior. Okay, so we have the pulmonary vein, superior pulmonary vein, pulmonary artery, and the bronchus. There is a relationship in both left lung, right lung. In the right lung, what happens? The artery is in the middle position, just behind the pulmonary vein, superior pulmonary vein. Inferior pulmonary vein is always inferior. How can you identify the bronchus at the root of the lung viscera? In the exam, in the dissection hall, when you got a lung, if the teacher asks you to identify the bronchus, very easy. Our formula is that vein, artery, bronchus, posteriorly located, and also please palpate by your thumb, okay, by your finger. You'll get hard feeling of the bronchus because it contains hyaline cartilage. You can easily palpate, and they have no cartilage in the arterial vein. Cartilage is present in the bronchus, so you'll feel hard. Lung, okay. What are the relations of the structures to the root of the left lung from above downward? Okay, so from above downward, very easy. Here we have the pulmonary artery, then we have the bronchus, okay, then we have the pulmonary vein. Okay, these are from above downward. How many pulmonary veins are present in the root of the lungs? Both the left lung, right lung has superior pulmonary vein, inferior pulmonary vein. superior pulmonary vein is above, inferior pulmonary vein is always lower, and it is always anterior superior pulmonary vein. Okay, what is eparterial bronchus and hepaterial bronchus? We'll go to the right lung, we'll find out that eparterial bronchus is the superior lobar bronchus. Hepaterial bronchus is the bronchus for the middle lobe and the lower lobe of the right lung. So eparterial bronchus is not present in the left lung. That is, those are the bronchus for the right lung. Okay. Okay. So we got this is the eparterial bronchus because it is above the artery. Okay. This is above the artery. Okay. And this is the hepaterial bronchus because it is below the artery. Okay. This is also called the superior lobar bronchus. Okay, this bronchus will go to the middle lobe and the lower lobe, inferior lobe. Okay, so what are the relationships of the, okay, what are the relations of the structure, the root of the left lung from above downward? We just discussed. That is the, we got that in our previous slide. Left lung, we have the artery, bronchus, vein. Okay, so if we go to learn the relationship of the structure from above downward in the right lung, then here this is the right lung, get it, the eparterial bronchus or superior lobar bronchus, right superior lobar bronchus, then artery, pulmonary artery above downward, then again hepaterial bronchus, then we have the artery, the vein, the pulmonary vein. Okay. How can you identify the bronchopulmonary lymph node? So bronchopulmonary lymph node, if it is present here, usually they are dark stained because they contain carbon particle. They are macrophage containing carbon. This is one. Another one, they have no lumen. They are solid structure, solid P-shaped structure. They are present in the loose irregular tissue around the bronchus. Their location is inside the hilum, and their number is variable, maybe 4, maybe 6, maybe large, maybe small, depending on the status of the health of the lung. Okay, so we got that. Suppose a person has lung cancer, his lymph node will be very enlarged. Okay, person has tuberculosis, lymph node will be enlarged. Okay, so okay, we got that. What are the causes of hilar lymphadenopathy? Any infection, maybe due to pneumonia, maybe due to tuberculosis, maybe due to lung cancer. Lymph node will be enlarged. Hilar lymph node will get large lymph node here. Okay, so what are the anterior relations of the root of both the lung? Both the lung anteriorly, we should have anterior pulmonary plexus. There is an autonomic plexus. We have the phrenic nerve. We have the pericardiaco or pericardiophrenik vessels. Okay. In addition to that, in case of right lung, we also add the superior vena cava and part of the right atrium. Okay. So these are the anterior relationships. Okay. What are the posterior relations of the root of both lung? Okay. Posterior relation is the, we should have the vagus nerve. Remember, phrenic nerve passes in front of the root of the lung, vagus nerve passes posterior, and vagus nerve plus will also get the posterior pulmonary plexus. Okay, in case of left lung, we'll also get the descending thoracic aorta in our relationship. This is the descending thoracic aorta. Okay, we got that. Now we got the structure on the posterior relationship. What structure passes behind the root of the left lung? Okay, behind the root of the left lung, the descending thoracic aorta. We've just seen it. This is the descending thoracic aorta behind the root of the left lung. Okay, we got that. what structure passes over the root of the right lung? Over the root of the right lung, this is the azygous vein. Then what structure passes over the root of the left lung? That is the arch of the aorta. This is the arch of the aorta. Okay, we got that. Now we got, where does the mediastinal pleura continued as pulmonary pleura? Okay, mediastinal pleura continued as pulmonary pleura at the margin of the hilum of the lung. We have gone through that part. Okay, so if you go there, here at the margin of the hilum, the mediastinal pleura will be continuous with that of the pulmonary or visceral pleura on the wall of the viscera. Okay, we got that. Okay, now we'll go here. Okay, we covered everything here. Okay, let me try here. So what is the mesentery or mesoneumonium of the lung? Okay, this is the mediastinal pleura. It makes a sleeve over the root of the lung. Okay, this is the mesentery or mesoneumonium of the lung. Another one is here. This is mediastinal pleura. Then two layers of mediastinal pleura come in close proximity, and this is the pulmonary ligament. Pulmonary ligament is important. It contains some loose irregular tissue. On physical exercise, pulmonary veins are enlarged, so it can give some space for the dilated pulmonary veins. Okay, this is the pulmonary veins, red color because it carry oxygenated blood. Pulmonary artery are it will be darker color here because they carry less oxygenated blood or deoxygenated blood. Okay, what is pulmonary ligament? What is its clinical importance? We discussed that during physical exercise when there is more venous return. Okay, the pulmonary vein will also be dilated. We need some extra space. This space may be accommodated partly by the pulmonary veins. Okay, we got that. Okay, now we got that. Okay, so is there any loose irregular tissue, connective tissue in the lung root? Yes, certainly. So all the structure around that we have the loose irregular connective tissue. Okay, so if you go there, here first image here. Okay, here you lose irregular connective tissue between the structure so that everything should be in position. So again, let us discuss. Hilum is the space, root are the structure which are present in the hilum. The structure get in, get out of the lung. Okay, then again hilum is the space, root of the structure, and mediastinum is the group of structure between the lung. Lungs are not a part of mediastinum. Heart, esophagus, descending thoracic aorta, and lot of other structure are the part of mediastinum. Okay, we got that. Okay, now what structure passes above the root of the left lung? Answer should be arch of the aorta. What structure passes behind the root of the left lung? Descending thoracic aorta. Okay, what is the relationship of the structure from above downward in the left lung? Okay, then we should have the left pulmonary artery. Okay, then the bronchus, then the pulmonary vein. How many pulmonary vein? 2 pulmonary vein. Okay, so we must know that part. Okay, now we got that. So how the relationship of structure at the root of the lung, right lung, this is right, from above downward. Then we have the upper lobar bronchus, then the pulmonary artery, then the Hepaterial bronchus, then we have the pulmonary veins. What structure passes above the root of the right lung? Again, what is this? Azygous vein. Okay, You have to know that part. Okay. What is pulmonary ligament? How it is formed? Pulmonary ligament is formed at the lower part of the root of the lung by the approximation of the two layers of the mediastinal pleura. It extends up to the diaphragm here. And we have loose irregular tissue that accommodate or help to keep all this structure together. And that's all about the structures and the relationships of the root of the lung. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.